Hello everyone, welcome to another Upgrade Your OET lesson with me, Sona from Bose Learning. In this lesson we're going to be focusing on OET listening part C and in particular the interview. The topic of this interview is dermatology and skin of colour and comes from the Royal College of General Practitioners. If you remember in listening part C, you listen to an interview as one of the listening tasks. You have various questions with multiple choice answers. As you listen, you read the question and then you decide which is the best option. For those of you who don't know me, I'm a premium preparation provider of the OET with Bose Learning. Thanks for joining me today. Okay, so first of all, let's just go through the questions themselves. We won't look at the options at this stage, and this is a technique you can try for yourself. When you have your preparation time, look at the questions and then try and identify what the question is actually asking of you. Then, of course, you get your options and then you listen. So the first question is, what was the goal of the project? So what are they trying to get you to listen out for? In this case, you're listening for the aim. So what was the intention of the project that you're about to hear some information on? Question 2, Dr. Morokenji, this is the lady who is being interviewed, thinks most clinicians working within dermatology, something. So what kind of things are we listening for here? Obviously, we've got the keywords such as clinicians, but really we are listening for her opinion. What does she think most clinicians working within dermatology do or think or feel, etc.? Number 3 is a very factual question. How can erythema present? So you're listening for a fact, you're listening out for some information, and then you're looking at the options and choosing the best one. Number 4, why does Dr. Ogunrendi think building a diverse bank of resources is important? So we have the keywords of resources, creating, building, etc. But again, what do they want you to find? They want you to find her opinion. What does she think? Or why does she think this? So it's opinion and a reason here. Number 5, why is patient-centered care so important when dealing with eczema in certain communities? What's the main thing they're looking for here? It's again opinion. Why does she think it's so important? What is it that's so important? So we're listening for her opinion about this topic. 6, according to Dr. Ogunrindi, most clinicians, again, this is opinion because we have according to. So quite often in part C, you're listening for opinion or connotation. Number 7, why does Dr. Ogunrindi mention travelling and using sunblock? So she's obviously going to talk about these two things, but we're listening for why she does this. So what was her thinking? What was her reasoning? She must have been wanting to tell us something. What was it? What was the purpose? And then number 8, why is understanding location important in diagnosing skin conditions? What are they looking for here? They're looking for fact. Why is it? It's important because of A, B, or C. Okay, let's have a listen to this interview. Again, as I say, it's from the Royal College of General Practitioners, and then we'll go through the answers. I'll move you through the questions as they move on. Don't forget, with the interview, use the questions to guide you so that you know when to move on to the next number. Here we go.
Welcome to this podcast from the Royal College of General Practitioners. I'm Dr. Sally Higginbottom, and today I'm interviewing Dr. Morokenji Ogunrendi, a GP in North Central London and a medical education fellow at UCL. She's been leading a project on teaching medical students about dermatology and skin of colour. Welcome, Morokenji.
Hello, Sally. It's great to be here. Thank you.
So tell me a bit about this project. What problem is it aiming to address?
During my time with the UCL primary education team, some of the students raised some concerns about the fact that their dermatology teaching had more images of lighter skin tones and They wanted to have more diverse images so that they could recognize what common skin conditions and complex skin conditions look like in darker skin tones. And so it was something that we were discussing in one of our weekly meetings and trying to brainstorm how we could help students in this area. And so the main aim of the project really is to diversify teaching in dermatology so that students, clinicians, nurses can recognize what normal skin looks like and what skin conditions look like in darker skin tones, where there has been quite a bit of a gap in the availability of educational resources in that group of patient population.
Why does the curriculum matter here? Why is it so important?
It's important because for us to offer the kind of care that we want to offer, for us to, know that we're giving either standardized care, varied care, patient-centered care, it's important to know what we're doing. And unfortunately, the outcry has often been, especially with skin conditions, that doctors, nurses do not quite understand what Black skin looks like or darker skin looks like, and also perhaps don't understand certain practices that occur within those communities. And if we don't understand what is going on, if we don't understand what the skin actually looks like, then there is often a bit of a delay in diagnosis. Sometimes we will end up trying out treatments that will not be palatable in certain patient groups. We might offend if we don't understand cultural practices. So there's quite a range of issues that arise when we start exploring the diversity that exists in dermatology, especially in skin of color. And so if we understand this better at a curriculum basis in medical school, then the hope is that we can then build on that knowledge as we do with all other medical conditions, from pathophysiology to physiology, and then ongoing to treatment and management.
So starting with the most obvious sign of many skin diseases, we usually look for erythema or redness. What does that look like in skin of darker colours?
So that is quite an interesting thing. We normally talk about sort of the non-blanching rash, pale and disappearing rashes. That doesn't often happen in skin of color. And it is just important to also say that when we talk about skin of color, sometimes people have an image in their head or in their minds of what skin of color looks like. It's just important to say that, skin of color is not a monolith. So it does exist on a spectrum, and it is important to know that a mixed race person or a lighter skin, dark skin person might actually have patches that look pink or red. But if we're talking about much darker skin tones, perhaps like mine, then erythema might appear, or inflammation might appear as hypopigmentation or hyperpigmentation. It might appear to look like something that might look like vitiligo, but actually isn't. It is a manifestation of inflammation. So those are things for us to bear in mind. But as we start seeing pictures of, okay, this is what this is and this is what this looks like, then we can then have a better understanding. And Sally, you and I were just talking about pattern recognition, which is a lot of what we do in primary care and as doctors. Once you've seen something once or twice, then it sort of sticks in your memory. And dermatology in skin of color is sort of the same. Once you've seen it a few times, then you're better able to manage it going forward, and you know what to expect. You kind of have an idea of what works and what might not work.
That's right. So if we think about something common like eczema, how might that appear differently in pigmented skin?
So eczema is quite an interesting one, especially because oftentimes in darker skin, the skin might often be a bit more dry, especially for those of us living in London, where the water is actually a lot harder than the rest of the country as well. That does tend to affect the skin. And in eczema as well, skin can look a lot darker. There can be quite a lot more pigmentation. There can be quite a lot of lichenification. So the skin can be quite thick as well in the consistency, a lot more rough in the consistency, as opposed to sort of the simple erythema, redness and bumps that we would normally expect as well. The look in eczema, even in mild eczema on darker skin, can actually look a lot worse than you would expect, even when it is mild eczema. So it's important to also understand what people have tried at home, especially in darker skin tones, because people are sometimes more aware that this is a common issue and might have tried quite a lot of emollients at home, which is quite common within certain communities of colour, where it is normal to use emollients because the skin does have a tendency to be dry.
Let's think about psoriasis. The textbooks say that psoriasis produces salmon pink plaques, and it might do on me, but I'm guessing it wouldn't do on someone with an African heritage skin. What does psoriasis look like?
So psoriasis is quite an interesting one as well, isn't it? Because, this standardized image of what psoriasis is supposed to look like, right? And so a lot of us, once we can close our eyes and we can imagine what psoriasis looks like, it's salmon, it's thick, it's scaly, but oftentimes in much darker skin tones, it actually can create quite purple patches on darker skin. And that can sometimes be slightly difficult to understand, because when you see that, it's what is that? I'm not quite sure what that is. But actually, it's a lot of times as well, the history can tell you what the diagnosis might be, but it does create some much deeper purplish kind of patches on darker skin, as opposed to that salmony type of image.
And thinking about serious skin conditions, we should always take a moment to consider skin cancers. And my understanding is that melanoma isn't related to UV exposure in deeply pigmented skin. Is that right?
Yeah, that is something that is actually quite interesting. And sometimes when we are screening for melanoma, when people present with mixed pigmented lesions, we screen them for their UV exposure. Where have you been? How frequently have you traveled to warmer climates? Have you used sunblock or sunscreen? But sometimes actually melanoma is not necessarily always related to UV exposure. And sometimes it can be related to X-ray exposure, scarring from burns, occupational exposure as well. So there's quite a wide range of things that can actually contribute to melanoma. And something as well in darker skin tones that we need to be more aware of is, because of the darkness of the skin tone, when you're looking at an image that could potentially be melanoma, your expectation of the diversity between what the lesion looks like and the skin tone looks like, it's just important to be sensitive that it might not have that significant contrasting image compared to a lighter skinned person. And then also the locations of melanocytic lesions in people of darker skin can often sometimes be different, and it's something that we should bear in mind as well.
So things like under the nails, subungual lesions and lesions on the feet and things are more common. Is that right?
Yes, that's correct. So lesions on the feet, fingernails, on the palms, in between toes, those are more common. And unfortunately, those are places that are normally hidden for most people. But once we have that in mind, then it makes us more sensitive to screen for it, or to ask people about it, or to just let them be aware that actually, these things do happen. And I think sometimes even I myself, melanoma was never something that I thought, I'm a dark-skinned person, we don't get melanoma, but that's not actually true.
Yeah, okay.
So, number one, what was the goal? It was B, to expand. It's not really about building a better relationship. It's not really patients have darker skin tones, can suffer from various problems, but really it's this educational resource bank. They want to teach dermatology students just to get them prepared and make sure that as many images are available as possible. So you colour in option B. Number two, it's A, and this is mentioned at the very start. They really want to offer great care to all their patients. Of course, it's what doctors always do, I know. It's what all clinicians want to do. You want to be able to offer great care to your patients. They're keen to make sure that everyone is given the same kind of care, no matter their background. So that's what the correct answer is here. It's not that they accept that care is different depending on the patients, and they don't really have a good understanding because some of the options are unknown to them. Number three, the fact we were looking for is that it can present as being red and patchy. She talks about patch. Number four, The more images clinicians can see, the better they are able to identify skin problems. So that was the whole idea. As you listen, she was saying it becomes easier the more that you see. And it's common sense too. Number 5 is B. A clinician can understand how the patient has tried to solve the problem on their own. So they might have tried various emollients before. That's part of the community practice. So finding out what they've already done will help the clinician carry on caring for the patient. Number 6 was C. It can be difficult to diagnose because they're not familiar with how it presents. Of course, if you're not aware of how it might look, then you might not be able to diagnose it. 7 was B. They need to be asked different questions. So whereas for someone with whiter skin, maybe travelling and using sunblock is important because of those UV rays, but actually on darker skin, so you need to be asking different questions to get to your diagnosis. And number 8 is for people who have dark skin tones, it might not be visible that they have a skin condition because it might be hidden. It's not that they hide it or it's not that they're more sensitive, it's just that it might not be in an obvious place. Thanks very much for listening to this OET listening practice with us. Don't forget to check out the other videos on our channel. We've got lots for you to work on, including reading and speaking and also writing too. And if you like this, click on the like button and share it with a friend or a colleague. Thanks very much for watching. See you next time. Bye bye.